My name's Scott Ingram. I'm a specialist plastic surgeon in Australia. I'm a member of the Australasian Society of Aesthetic Plastic Surgeons, ASAPS, and a long-standing board member of ASAPS. I'm also a past president of ASAPS. More recently on the board at ASAPS, we've been working on a project to assist patients understand the complex minefield of cosmetic surgery in Australia and New Zealand. And in doing so, we've established the Australian-New Zealand Cosmetic Plastic Surgery Board, or Board of Cosmetic Plastic Surgery. That's the ANZBCPS.
It is important that we establish the board because the board is not just about your qualifications, which is also very, very important, but also about maintaining your qualifications. So it takes us at least 8 to 10 years of our medical training to become a specialist plastic surgeon. But after that, we also need to maintain our knowledge, our standards, know about the regulations and new technologies, new techniques. And that maintenance of education is just as important as the qualifications, because that maintenance of education needs to go on for at least 20 to 35 years after you're qualified. So the board basically ensures that the cosmetic plastic surgeons who perform cosmetic surgery continues that education in the interest of the services that we provide and the procedures that we provide.
Now, the ANZBCPS has been established in response to the more recent cosmetic surgery guidelines that have been established at AHPRA in conjunction with the Medical Board and the AMC here in Australia. And what we've done is we've come up with a board certification process that is with the Board of Cosmetic Plastic Surgery, which allows patients to understand at once who the surgeon they're looking at is, what their qualifications are, and how they've maintained their currency in the area of cosmetic plastic surgery. This is something which is really important for the safety of our patients. In January, some research was conducted and some quite interesting findings came out of that research. It includes facts such as 58%, so nearly 60% of patients struggle to find the right surgeon, that is patients looking to undergo cosmetic procedures. 44% of patients found that they were unable to trust the information they were finding online about cosmetic surgery and the surgeons they were looking at. And 1 in 4 of these patients, so 25%, in fact, slightly higher than 25%, patients were very unclear about who's actually legally able to perform cosmetic surgery in Australia. And fourthly, almost 40% of patients really felt that they needed to be able to get more information when researching cosmetic surgery and cosmetic surgeons. I think this is really important, and it goes to the crux of why an entity like the Board of Cosmetic Plastic Surgery, the ANZBCPS, is really needed in this country. There's a number of requirements that need to be met for somebody to gain ANZBCPS board certification. In fact, there's 7 requirements. Firstly, anybody in this country who would like to be ANZBCPS board certified will need to be a qualified specialist plastic surgeon having successfully completed the requirements of the training program with the Royal Australasian College of Surgeons. Secondly, they need to be registered as a specialist in this country with AHPRA, and that's pretty important. They also need to be a member of good standing with one of the national societies at least in this country, so that's either ASPS, that's the Australian Society of Plastic Surgeons, or ASAPS, the Australasian Society of Aesthetic Plastic Surgeons. Now, most specialist plastic surgeons in Australia are a member of both, and virtually all are a member of at least one of those. In New Zealand, incidentally, you would need to be a member of the New Zealand Association of Plastic Surgeons as well. You need to be actively involved in the practice of cosmetic surgery. Over and above that, you need to complete CPD requirements as listed on with the Royal Australasian College of Surgeons. And in addition to that, you need to nominate RACS as your CPD home. Now, lastly, and perhaps most importantly, as far as the ANZBCPS is concerned, you need to also complete the annual recertification requirements or the annual CPD requirements with the ANZBCPS. And that's how you get your board certification with the ANZBCPS. The reason we've established the Board of Cosmetic Plastic Surgery and this board certification process is to close the gap that was identified in the research performed earlier this year to address patient safety, really. This is something which is extremely important in the area of cosmetic surgery. It's extremely important for cosmetic surgery patients, and it's important for our profession.